Hey guys, it's Dr. Witten of Adonai here. So I'm just kind of showing you how we set up for the colon hydrotherapy treatments here at Adonai. And yes, I do the setup. So I do have my assistant who helps me out. But today I'm doing the setup on my own. So forgive me if I look like I'm bending because I am. So I want you to be able to see my face. So we put down the padding here on the bed. And underneath all of this, and I just want to be able to show you, if I pull it up just a little bit here, there is a mat. If you can see, there's a mat here. This is our mat that does a pulse electromagnetic frequency treatments. Okay, so the impulses are emitted through the mat, and then the patient is connected to the mat because they're lying on the mat, and so that's how the treatment is administered. Okay, there's a whole console in the front that I program for specific treatments that is specific to the patient's needs at that time. So that's that. Okay, so that goes down. And then our pad goes down. So this is a big pad. They use these a lot in nursing homes with patients who are convalescing, or patients who are extremely ill and they're bed bound. Okay, so that goes down. And then on top of that, we have these what they call chucks. So these are these disposable pads as well, and that is waterproof also. Okay, so here we put down 2 of these in case there's any leakage when the patient is having the procedure. So I like to lay down 2 of these, and I like to overlap them like so. Okay, so again, this gives the patient the added protection. And then also psychologically, the patient feels more relaxed because they're not as tense, because they know, God forbid, if there's some leakage or they have a bit of an accident, that it's not going to make a mess everywhere. Okay, it will be contained in this space. So this goes down. And then on top of that, we put the bed sheet. So this actually goes down as well. And this is used to cover the patient. So this is used as a kind of drape for the patient. So let's get this down here. I'm going to step out of view maybe for a little while. And so this is all a part of the process, guys. Okay, so we take care in this process to make sure that everything is done correctly and that the patient is made to feel, or the client, right? So colon hydrotherapists can, they can't say patient. I can say patient because I'm a doctor, but therapists have to say their clients, right? Because they're not healthcare providers. So anyway, I make sure that this is all, that the bed looks nice and neat and tidy and clean, first of all. Okay. So we fold this down here as well. There we go. So the bed is now made and ready for the clients. Okay. I use this light here. So this light specifically will allow me to be able to, so what it does, it magnifies the view. You'll see the light coming on in a second. So I look through this glass here, and it gives me a magnified view of the patient's body. And I can see very clearly the area of the patient's body where I'm going to insert the speculum. Okay, so it gives me that additional magnification, so to speak. And I can also view, the the anal area to make sure, looking for any hemorrhoids or any signs of fissures, etc. That would be that would kind of disqualify the patient or the client, sorry, from having that procedure. So we do have an intake form ahead of time where we ask these questions, and then I review it with the potential client while they're in the room with me here and I'm setting up. And then so if there are any disqualifying criteria whatsoever, then that person will not be administered a colonic. Okay, so I'm going to turn this light off. So that's something that I use. I'm also going to, let's see if I can do that. Sorry, I'm out of sight of the camera again. I'm going into my storage basket where we store our speculums, right? So this is a package. This is a speculum package. Okay. In the package, you have 2 sets of tubing. You have a wide tube here, right? This is the wider tube. And then you have a tube that's more narrow in diameter, right? So the narrow tube is where the filtered water comes in. So the water is purified through filtering. And then the larger tube is where the waste exits the body and goes down into our sewer system, okay? Then we also have this device in here. This is called the speculum. And so that is designed kind of, I'm going to show you the picture here, right? So that's the speculum. It consists of 2 pieces. And so this is the part, the speculum is the part that actually enters the body. And so let me just move this out of the way. And maybe I should open one, but the speculum, these kits are very pricey, so I don't really open them unless I need to. But about this much from here, from my finger here to about here, is what actually goes into the body, okay? Now we use a natural lubricant, okay? So it does come with a petroleum-based lubricant. We do not use that, right? Because, petroleum is not something that you want to put inside the body. You don't want to use that internally, right? So we don't use that. So I use a natural emollient as a lubricant, and this is from a company called Wise Women Herbals. I do not receive any contributions from them for saying this. Any monetary contributions. I mean, specifically, I just like the salve, right? So I'll tell you what's in it. It's organic olive oil, and it has calendula, comfrey, vitamin E, and vitamin A, right? So this is what I use here in the colon hydrotherapy suite. So everything that's in this kit is disposable, right? It's per patient. Once I open this up, it's used on the patient, the entire kit, and then it's discarded, okay? There's no cleaning of anything. There's no reuse of anything. It's used once and it's discarded. One and done. Okay, so I'll put that there. And then I'm going to just turn on the device. This is called the device. Okay, we are trained not to call it a machine. It is called a device. Okay, and I'm just going to move this a little closer and hopefully you can see it. Doesn't matter if you see my face at this point. I just want to show you the equipment. And I'll move my water bottle out of the way. Put that on the floor. Okay, so so this is the actual colon hydrotherapy device. This is by Hydrosan. Our particular equipment is manufactured through Hydrosan. This is one of the newer units that I have here. And so here at the top chamber is basically used to sterilize, right? So this is where the liquid, the sanitation liquid, or the sanitizer is and it's quite potent, it's heavy duty, and so it's stored in this tank. And so after each colon hydrotherapy procedure, what we do is we turn on here the water, and I'm gonna turn it on because the sanitizer hose is in place. I'm gonna move the light out of the way a little bit. Let's see if I can get this out of the way. I'll just move this out of the way because I don't need the light. Okay, so here is the sanitizer tubing. This gets put in place. This is the warmer, right? So the warmer will take the place of the sanitizing tube, okay? After the device is sanitized, thoroughly sanitized, the next step would then to be to attach the warmer so that the water can be brought up to the therapy temperature. And there's a gauge here, a temperature gauge here, that tells me that when the water is warm enough to begin the therapy. But what I'm going to do is, and I have a little plate here where I keep my warmer. So I'm going to turn on the water just so you can hear, right? So you can hear that. That's just plain water going through and flushing the tubing. And this is where the waste that is leaving the patient's body, or the client's body, sorry, would travel through this tube. So it is possible for the client, if they choose to have a look to see what's actually leaving their body, okay? This lever here, I'm not gonna turn, but that allows the solution to mix with the water and to clean this tubing out. So this cleanses the device, okay? This gauge here is the pressure gauge, right? So this tells me, and it's color coded. So the blue is the area where it's filling, and then it will transition into the green. Okay, that's the pressure is increasing that way. Usually, you know, as the dial leaves the blue zone and enters the green zone, that would be around the time that the patient is ready to release. So I can usually tell, but I always say that my patients are the best barometer. They know best, okay? Sorry, my head is chopped off. I should probably just kneel a little bit. Actually, I'll get my stool. I'll get my stool and I'll sit on it. This is all real here, guys, right? Nothing edited. This is live. This is real. So I was saying about the pressure gauge, right? So this is the temperature gauge. This is the pressure gauge. So I always tell my patients that they are the best barometer, okay? When they say that they're ready to release, that's when I turn the lever, right? So if the lever is here, I am filling. That means there's water going into the patient's body, into the colon. Once I turn the lever to empty, the water with the waste, right? The contaminated water, the water with waste will then begin to come through the tubing and down into the sewer unit. Okay, this button here controls the flow of the water, so I'm not going to turn that because I don't have the warmer tube in place. I have the sanitizer tube in place. So if I turn this on, there's going to be water coming out, shooting out of here because I don't have the warmer tube in place. All right. And then here's another button here. Well, it's not a button, it's a lever. So this lever will control whether the water coming out of here is hot or cold. So I can turn the lever to make the water cooler, or I can turn it to hot to make the water warmer. Okay. So this basically is how this device is controlled by the therapist. I'm in constant communication with the therapist. As the therapist, is on the bed. And I have to remember not to say the word patient, because even though I'm a licensed naturopathic physician, I am in the place of an IAC certified practitioner when I'm in this space and performing this particular treatment on my patients. Here I go again on my clients. So yeah, this is colon hydrotherapy. This is the procedure of cleansing the colon with filtered water. Okay. So from beginning to end, if it is a new patient, here we go. If it is a new client, what I would do is I would take the first 15 minutes to go over their form. We generally send them the intake form ahead of their appointment so they can complete that and bring it back to us. Then I would be sitting in this room with the client. I would review their responses. If I needed clarification on some of their answers, then I would ask for clarification, or I would ask them additional questions to clarify what their response is. And so then the client would be asked to go into our restroom facility, which is right next door, directly next door to this office and or this space, and they would then empty their bladder. It's very important to empty the bladder if you want to be comfortable during this treatment. If your bladder is full, and there's water going into the colon, it's not going to be comfortable at all. So we do require that prior to the start of the therapy, that the bladder is empty. So the bladder is emptied. The client is provided a gown, so they would put that gown on with the opening in the back. They would remove everything from the waist down, and then they would get on, into the bed, right? They would be covering themselves with this white top sheet. I would instruct them to make sure that the hind part of their body is directly square in the middle of the mat. How we start the therapy is we start the therapy with the patient being on their side. So the patient would lie on their side. And in this case, it would be their left side, facing the wall, which is behind me. No, actually it's in front of me. Behind me is my mirror, but facing the wall in front of me, which you can't see. We ask the clients to bring their knees up to the chest as far as possible, or where it's comfortable for them. And that would be the position in which the procedure would begin. Once the speculum is inserted, the client is able to then lie on their back with their knees bent. And that's generally the position that they retain throughout the entire colonic or colon hydrotherapy experience. Okay? After the experience has ended, the client would then step down from the table. They would go into the restroom. They would sit on the toilet, making sure that both feet are placed on the stool. The name for that is the squatty potty, right? But there are other toilet stools available other than the squatty potty, which just happens to be that name that manufacturer has chosen to use for his particular stool, but a toilet stool in general. And so the feet will then go up on the stool, because we are designed to have a bowel movement when we're squatted, right? When we're in the squatting position, because there are actually, once the calf muscle is activated, it then activates or triggers a reflex that actually goes to the rectum, right? And so that allows for a bowel movement. And yeah, that is a fact. Learned this in anatomy, right? So yes, squatting is a healthy way to have a bowel movement. And so we facilitate that by having that stool in the restroom, where the patient is able then to flex their hips, which means to have their feet up on the stool with the back straight. We instruct them to keep their back straight. And then so whatever waste is left in the colon will then be eliminated whilst they're sitting on the toilet with their feet up on the stool in the squatting position. And then they have the benefit of gravity now to further empty the colon. And then that would mark the end of the therapy for them. The patient then comes back into the room, and we provide them with with a drink, which is water with some electrolyte powder in there, and that gives them some potassium and some magnesium. And then I also provide my clients with capsules of activated charcoal, because during the process we have dislodged toxins, especially if we're moving old material that has been sitting in the colon over time, accumulating. We know we're going to dislodge some toxins with that. So by taking the activated charcoal, we can kind of mop up the toxins that we've dislodged, and so it will be bound and then excreted from the body the next time that the client has a bowel movement. And then I go over some, just to finalize or just to close or mark the end of the therapy. I would go over the therapy session by asking some specific questions of the client, and I would just check that off so we have a record of the client's experience. And so that basically is, the colon hydrotherapy treatment that we offer here at Adonai Optimal Health and Wellness. So gut health is essential, guys. You cannot effect healing efficiently unless you address the issues of the gut. Okay, so thank you for joining me here in our colon hydrotherapy suite at Adonai Optimal Health and Wellness. We are located at 887 Main Street. We are in Suite D, as in David. So when you come through the double doors, you'd walk to the end of the hallway, make a left turn, and that's where you would find our suite. And so I hope you enjoyed this little discussion of the description of colon hydrotherapy. It's, it sounds a lot more scary than it actually is. Once the speculum is inserted and the therapy starts, it's quite comfortable. Most of my clients are talking to me. We're exchanging in conversation. We laugh, etc. Yeah. So if you would like to know if you can benefit from colon hydrotherapy treatments, give us a call. Our toll-free number here is 888-655-8489. Thank you for joining me. Have a wonderful day.